It's my great pleasure to participate in this celebration of 30 years of partnership between the U.S. and Georgia in the field of public health. Here at IHME, we are focused on trying to produce global public goods, the global burden of disease, understanding of future forecasts, understanding where resources for health go, and we're focused on those global public goods, but producing them together with a network of 8,000 collaborators in 156 countries. And I'm happy to say that some of our strongest and most fruitful collaborations have been with collaborators in Georgia, particularly at the Georgia National Centers for Disease Control and Public Health. Our formal collaboration with NCDC started in 2014. We signed a memorandum of understanding, and that has really opened up a very productive and mutually respectful 8 years of work together. We've worked together on a number of things that have contributed to better assessments in the GBD for cancer in particular, for causes of death, but also for things like COVID, which I'll come to in a moment. Now, that work together has also had certain projects that we've collaborated on, or we hope we've made some contribution to the real progress in Georgia, led by the NCDC, on things like disease registration and challenges in the cause of death system. Georgia NCDC team has been working closely on not just sharing the latest data for the GBD and trying to help analyze it, but that critical role of making sense of the results. I remember a conversation we had during the COVID pandemic where the team said, look, the excess mortality that we're seeing in Georgia can't all be COVID. It has to be due to deferred care for other diseases. And I think that discussion is an example of that intricate local knowledge and making sense of the data as it came through, and very much led us to sort of rethink what we were seeing in the data, not just in Georgia, but in other countries in the region. During COVID, as we at IHME pivoted to trying to track and model and forecast the epidemic, it was wonderful to work with the team at NCDC, making sure that we were using the best data on vaccination, on case reporting, on a variety of drivers of the COVID epidemic. And in turn, I think the modeling that we were able to do, informed by our colleagues at NCDC, turned out to be useful in Georgia as well. So on behalf of IHME, I'm very grateful for 8 years of collaboration and to the commitment to scientific excellence at NCDC. And I very much look forward to the next decade of work together. Congratulations again. Good luck for the future.